everybody, and welcome to the podcast, Coffee with the Kensington, where each month we discuss all things related to seniors, their families, and caregivers. My name is Brenda Moynihan, and I'm the Director of Marketing and Outreach at the Kensington Assisted Living, and I'm your host. Today's podcast is about Certified Home Health Care, or CHAS for short. And my guest today is Joanne Parliament. Before we begin, I'd just like to read you some information about Joanne. Joanne began her career as a staff nurse and assistant head nurse at St. Joseph's Medical Center in Yonkers. She is a registered nurse and graduated from Mercy College with a Bachelor's of Science in Nursing, plus she's got an MS in Healthcare Administration. Joanne previously worked as the Director of Admissions, then the Director of Patient Services for Visiting Nurse Services of Westchester. Currently, she works as the Director of Operations for Tender Loving Care at Amedisys Westchester branch. And just so you know, folks, Amedisys is one of the largest home health care providers in the country. And welcome, Joanne.
Thank you, Brenda.
Sure. So let's get right into it. Let's talk about CHAS. Joanne, do me a favor, tell the audience what exactly is a certified home care agency, CHA?
So a certified home care agency is a Medicare certified home care provider. We also accept other insurances, but it's certified by Medicare to provide intermittent skilled services to clients in the community. Skilled services entailing skilled nursing, physical therapy, occupational therapy, speech therapy, and also as ancillary services of social work and home health aid.
Right.
So the definition of a CHA is a Medicare certified home care provider that provides intermittent skilled services to someone in the home. So what qualifies somebody for that would be that they would have to have an acute onset of an illness, i.e. hospitalized, or they've gone to a short-term rehab for care, and they're coming home to their home with a change in their condition that requires monitoring and perhaps physical therapy to bring them to their pre-functional status. Or they have visited their physician and they've had a decline in their condition or a change in their medical condition. Perhaps the doctor is organizing their medications for monitoring of blood pressure or diabetes, and the nurse can come in to instruct on the medications, ensure that they are responding to them the way the doctor would want to, and report back to the doctor.
Okay, so in essence, CHA services come into the picture when someone is in a hospital, they go home, and they need a social worker, they need someone to assist with the activities of daily living for a period of time. Or the doctor can write a prescription for someone who maybe fell at home. Is that correct? Am I hearing that right?
Correct, but
Okay.
Remember, the social work and the ADLs, activities of daily living assistance, are ancillary services.
Okay.
They have to have a skilled need. They have to have a need for a nurse to come in and monitor or educate. They need a physical therapy need where maybe they need to instruct them on a home exercise program or do a home safety evaluation and recommend changes to the home to make it safer for them. Speech therapy to work on swallowing difficulties or verbalization.
Right.
Now, to qualify for services through a CHA, you need to meet certain criteria. You have to have had a face-to-face with the physician within 90 days prior to the start of the home care services or 30 days after, related to the reason why you're being serviced. So if someone's in the hospital, clearly they're going to have a face-to-face with the physician because the doctor in the hospital would have seen them.
Right.
If a doctor is going to make a referral from the community, he would have had to see the patient either in the office, or now Medicare is including a televideo visit as a face-to-face encounter to address the reason why they need the home care services. That's one criteria.
Okay.
The second is they have to have a physician in the community that would be willing to work with us if we have questions regarding their care, to collaborate their plan of care with, and to sign our orders.
Okay.
Third, and most importantly, is they need to be essentially homebound, which means that they have to have a taxing effort for them to leave the home. If they're able to get out and drive and walk at the mall, etc., they don't qualify for home care services. They need to
Okay.
be essentially homebound. And lastly, the services are short term. We're not a long-term company, and the services are intermittent. The nurse may visit one to two times a week as we taper down every other week. The therapist may start twice a week, decrease to once a week, taper down. And then once their goals are met or they've plateaued where we've reached as much as we could with them, they're discharged from services.
The key I'm hearing though is a skilled need and homebound.
Correct.
Right?
And a doctor that
Right.
needs to
And
be
that
involved.
important. And what's the goal? What's the goal of the person, the 85-year-old senior at home? What is the goal of the care?
The goal of the care is to ensure that we keep the patient out of the hospital, that they're going to lead a quality of life. They're going to understand their disease, whatever comorbidities they may have, that they understand how to manage that at home, that they understand their medications that they're taking, and that they're doing exercises to keep themselves healthy and strong,
Mm-hmm.
and that their home environment is safe enough for them so that they can maintain themselves in the home. That's the goal of home care, is to keep people in their home where they're safe and that they can manage their illnesses so that we can prevent them from going into the hospital.
Joanne, take us from the very beginning. What should our listeners expect and the families? Let's give the example of someone going home from the hospital.
So what they could expect is that the home care agency will call them the evening before just to enforce the fact that the hospital made the referral and to make sure that they're agreeable to the home care services. A clinician will visit them in the home, either a physical therapist or a nurse. They'll do an extensive evaluation on them, which may take an hour to an hour and a half, where they do a thorough evaluation about their mobility, review their medications, they'll look at their home environment, and based on that assessment, they'll discuss with them a potential plan of care, what services will be involved, what the projected visit frequency will be, and then they'll call the office, collaborate with myself in the office, and as well with the physician, because the physician needs to agree with the plan of care that we've set out for the client.
Okay.
And then based on that, they'll follow up with them based on the plan of care that they have projected. If they get better sooner than we had projected, we may decrease the visit sooner. We may discuss a discharge sooner. If they decline, we could increase visits, include more services. The Medicare certification period is usually 60 days. Doesn't necessarily mean that someone gets services for that long, but it doesn't also necessarily mean that they're going to be discharged in 60 days. If they're not ready to be discharged in 60 days, we'll contact the physician again and talk about extending the plan of care for them.
Okay. And I'm sure my audience is thinking what I'm thinking. How is this paid for?
So Medicare covers the services at 100% as long as they meet the criteria that we talked about earlier.
Okay.
If they have a third-party payer, i.e. a managed Medicare plan, like Aetna Golden Age or United Health or Blue Cross, some of those plans have copays and deductibles that they have to meet while they're on program. And some of them also require that they utilize providers that are in network. So realistically, the patient should have a choice when they're in the hospital of which home care provider they would like to use. So the hospital or the nursing home should be providing them with a list of providers in the area, and the patient should be able to choose the one that they want. If they have Medicare, they can pick whoever they want that's Medicare certified.
That
If
was,
they have a managed care plan, then they may have to choose a provider that is in network, or sometimes they have out-of-network benefits, but they may charge a higher copay, or you have to meet your deductible of out of pocket, and it would behoove them to stay with the provider that's in network.
and that leads me, that was going to be my next question. How does someone get a referral for your organization, Tender Loving Care? If somebody says, I heard this woman, they sound wonderful. I looked them up, I researched them. I really want my mom to have this CHA, this certified home health agency. How would they get the referral? You're saying the hospital provides a list. Is that correct?
Yes,
Okay.
the hospital should be providing a list.
Okay.
Should be. But, sometimes they recommend a particular company for the patient, but the patient has the right to choose. So if the patient says, I want tender loving care with the Medicis, they're going to tell the discharge planner at the hospital that this is the provider that I would like you to refer to. The discharge planner would refer directly to us. Many of them use an electronic venue that they send us the referral, or they can contact us directly, and I'll give my contact information at the end of our presentation. And the same with the physician. If the physician feels that they need home care services, then he can contact us directly by either calling us, but we would need him to fax orders with that face-to-face encounter, which would be his visit note that he saw the patient, acknowledging the fact that they need services based on the reason why. So say, for example, a patient has a wound and they saw the doctor, and the doctor says, I need a nurse to come and care for that wound and teach you how to care for that wound. The doctor would send us his note addressing the fact that patient X has a wound on her leg or whatever, and this is the service, this is the wound care, and that'll all be in the note, which would be faxed to our office.
Okay. Now, I'd like my listeners to learn and kind of understand, you represent a CHA, Certified Home Health Agency, but there's also something called a LICSA, a licensed agency. Can you tell my listeners what is the difference between them?
Sure. So the difference between a CHA and a licensed agency, so between a certified and a licensed, is a licensed agency is more of a private pay agency. And that's more like private duty,
Okay.
where you don't have to have a skilled need, but you need supportive services in the home. You need somebody to be there so that you don't fall, that you may not be able to care for yourself, that you need somebody to cook meals for you, or escort you to the physician's office, or remind you to take your medications, or do light housekeeping, things like that. There you would hire from a licensed agency, and usually people hire anywhere from 3 hours to a live-in, but it's all paid privately. Or if you have a long-term healthcare policy, you might be able to access that to help pay for your services. There are Medicaid provided services in the community, and clients could get caregivers through them. And that might be through a licensed agency or a consumer directed program where you hire someone yourself, but that's not a service that we provide. So
Okay.
I just want to also reinforce that we do provide aid services as an adjunct to the skilled services that we provide, but the aid is strictly for personal care, strictly for bathing. So people have a misconception that the aide is going to cook for them or stay with them for a while, because, it's nice to have someone in the home.
Right.
It's a comfort to have somebody there to make sure that you're safe. But Medicare doesn't cover custodial care. And more of the licensed agencies pay for custodial care versus skilled. And, we know that it's nice, you need to have a bath while
Right.
you're on program. And also we may include an occupational therapist when we provide an aid to evaluate the bathroom, make sure they have the right equipment, make sure they're transferring, because the goal is independence.
Right. Right.
That's the goal.
Because I want you to be able to give the listeners your contact information, I just want to have a little wrap up here. So for a certified home health services agency, in order to get services. Have to have a skill need. You could be living, coming to your home from a hospital stay, or doesn't have to be, but there also has to be that physician involved, right? The physician's orders. Not custodial care, right?
Correct.
And it could be covered through Medicare, but it's not infinite. There is a finite period of time. And if you want to continue care, you would actually have to look at a licensed agency, because that's private pay. Again, I'm generalizing everything. There are some other things involved, Medicaid, but that's
Okay.
the gist of it. So, Joanne, why don't you tell the listeners, if they'd like to contact you, get some more information about yourself and Amedisys, why don't you give your contact information?
Okay, so I just want to let everybody know that Tender Loving Care, our care center, is a new care center in the area. We have a fabulous group of clinicians that work for us. We've been open since November of 2021. And we've had wonderful feedback from the clients that we've been servicing in the community. If you have questions and you want to speak to me, even if you have questions regarding whether you want to know if you're qualified for home care services or your relative qualifies for home care services, you can reach the office at 914-205-5708. Our fax number is 866-380-0560. I also just want to let the listeners know that since Amedisys is the largest home care provider and one of the largest in the country, we have multiple care centers all over the country. We have one in Connecticut that services from Greenwich to far past Shelton, across to Danbury. We have two on Long Island. We have a couple in New Jersey, Secaucus and Hackensack. So if you have questions about care and you're a snowbird, we have ones in Florida. You can always Google Amedisys, and you can have access to care centers all over the country, which is a great thing, because if you move, we can always transfer you to another care center.
Great. Thank you. Thank you so much. I want to thank my listeners. And folks, as always, if you'd like more information about the Kensington, please give us a call, 914-390-0080, or please go to our website at www.thekensingtonwhiteplains.com. Thanks so much for joining us.
Thank you.